we're watching the attendee numbers rise as we're speaking. So that was the reason that we started a few minutes late. My name is Roberta Carlin, and I'm the Executive Director of the American Association on Health and Disabilities. We are located in Rockville, Maryland, and the mission of AHD is to advance health promotion and wellness initiatives for children and adults with disabilities. We are very excited to be able to present this webinar to you and be able to have established, along with our partners, the National Disability Navigator Resource Collaborative. Our two speakers today are Taryn Mackenzie Williams, who is the Associate Director in the Office of Public Engagement at the White House. And we thank you very much, Taryn, for joining us. And Carl Cooper, who is an attorney and the project manager for the NDNRC project. Before we get started, I would just like to go over a few housekeeping details. The webinar will be archived on the AHD website at the end of this week. If you require the use of an interpreter, please make sure that your webcam is turned on. And please submit your questions in the chat box, and we hope to have a period of time at the end of the webinar to answer your questions. We will do our best to answer all the questions, but if not, we ask you to please email them into us, and Carl will give you the email address at the end of his presentation. Again, thank you very much for joining, and I'd like to now turn the webinar over to Taryn. Thank you again, Taryn, for joining us.
Thank you. Thank you, Roberta, for that introduction and for having me here today. Good afternoon, everyone. As you learned, I am Taryn Williams, the Associate Director of Public Engagement for the White House, and in this role I serve as a liaison to the disability community, which means that I have two main responsibilities. First is making sure that the disability community's issues and interests are being heard throughout the White House and the broader administration, and the second is to ensure that the priorities of the administration are communicated directly to the disability community. The Office of Public Engagement is sometimes called the front door to the White House because we exist to ensure that individuals have access to our work as an administration and an active role in our governance. I'll give you a little bit of background about myself, and then I want to share a little bit of detail about our work, particularly around the ACA. So I come to the White House by way of the Department of Labor, where I worked on a youth policy team focused on people with disabilities and chronic health conditions transitioning into the workforce. I did that for approximately 5 years. I also spent some time working with Congress and at a small education nonprofit, also for about 5 years. I share all of this because despite my current broad focus on all disability policy issues, my passion is and always will be making sure that individuals, particularly young people, have the supports that they need to transition into the workplace. I know that everyone on this call and webinar understand that healthcare is one of those critical supports. I myself grew up with a chronic health condition, something called ulcerative colitis or inflammatory bowel disease. It was something that took me in and out of classrooms quite often and gave me a very early exposure to the healthcare system. I was lucky. I had healthcare. I had good doctors who coordinated with each other and made certain that I got top-notch care. I had one of those super strong single moms who could somehow carry a full-time job and be everywhere at once while coordinating my doctor's appointments. And that fortune continued into my adulthood, but not without some significant obstacles. At my very first job over a decade ago with a very small nonprofit, I was denied insurance due to my pre-existing condition. It was just a flat-out no. And it was life-changing and, quite frankly, unexpected because up until that point, I'd never given thought to the belief that one could just not get insurance even if they had a job. And I know you all have heard these stories before, but what worked out for me at that time was that I was still young enough to jump on my mother's coverage as a dependent. And luckily, that coverage was in place when only 3 months later, I found myself in the hospital with a flare and something that evolved into a need for emergency surgery. To this day, I don't know what the final costs of that hospital stay were. I just know that had I not had insurance, it's questionable whether or not I would be where I am today professionally. I would have quite a bit of debt, and I know that my employment prospects would have been significantly different. Every 5 weeks, I still go to the doctor. I sit in a doctor's office receiving expensive medications for my conditions, and at times being frustrated and incredibly grateful that I have a job that employs me and provides me with insurance that gives me access to the treatments I need to work. This is what we want for all Americans, including Americans with disabilities. So it's with the dawn of the 25th anniversary of the Americans with Disabilities Act that I wanted to come on to the webinar and spend some time telling you what your work has meant thus far and why the ACA and your continued efforts are so important. Healthcare is not just about access to doctors and medicine. It is about giving people the quality of life that they need to learn, earn, play, and have full inclusion in their communities, or quite simply, the goals of the Americans with Disabilities Act. That is why this issue is so deeply important to the President and to the disability community. I'll tell you some things that I know you know. In 2010, President Obama signed the Affordable Care Act into law. In doing so, he put into place comprehensive reforms that improve access to affordable health coverage and protect consumers from abusive insurance company practices. During the last open enrollment period, many of you worked as navigators, certified application counselors, organizations, and volunteers to enroll millions in affordable quality health insurance plans through the marketplaces and through expanded Medicaid programs, which are particularly important for our community. What that means is today we have 6.7 million Americans enrolled in the marketplace. We've got 9.7 million additional individuals who are enrolled in Medicaid and CHIP compared to last fall. We have millions of young adults under 26 that have been able to access coverage by staying on their parents' plan. And all combined in just 1 year, we've reduced the number of uninsured adults by 26%. Additionally, 76 million Americans with private health insurance are getting preventative services such as vaccines, cancer screenings, and yearly wellness visits for free. This includes nearly 30 million women and over 18 million children. And millions of families are more financially secure as insurance companies can no longer deny them coverage because of pre-existing conditions or because, and this is again very important for our community, or because they reach an annual or lifetime limit in coverage. The ACA has been a game changer. It has helped to improve hospital safety, contributing to 1.3 million infections avoided and 50,000 lives saved from 2010 to 2013. It's also helped to avoid hospital readmissions up to 150,000 through better coordination and care. All told, these data are evidence that the ACA is working, but we could not be where we are today, specifically within the disability community, without your vital work in making sure that we educated and enrolled as many individuals as possible. I cannot thank you enough for your support, even when the website didn't work, and your hard work. We are off to a very strong start with what we like to call OE2, the open enrollment, the second open enrollment period. The marketplaces are open until February 15th. We've got a month to go, and we want to make sure that you're doing everything possible, and I know you are, to get the word out. I've got some numbers hot off the presses that I want to share with you today. Just a little bit of evidence of what your work in the past few months have meant to millions of Americans across the country. As of January 9th, nearly 6.8 million consumers selected a plan through the federal marketplaces or were automatically re-enrolled. More than 2 million of those 6.8 million are new enrollees, and 87% of people who selected 2015 plans are getting financial assistance to lower their monthly premium. So that's 87% are getting financial assistance to lower their monthly premiums. This shows us that millions of Americans want access to affordable quality health insurance, and that they're coming to the marketplace and to all of you to find it. We are pleased with the response to date on open enrollment, but we know that we still have a lot of work to do in the next 30 days. We need to enroll millions more to reach our goal of 9.1 million individuals enrolled in marketplace coverage. And there's some great news for those new enrollees. More than 90% of consumers are able to choose from 3 or more issuers, up from 74% in 2014. And consumers can choose from an average of 40 health plans for 2015 coverage, which is up from 30 in 2014. But these new enrollees will be harder to find. We will need you to reach farther into the communities across the country to make sure that you're communicating to folks we didn't reach at the beginning of this open enrollment period or last year. And we have less time and quite a bit more pressure as we continue to see some attacks on the health care plan. That's where you come in. You can and do and will continue to play a critical role in helping to provide millions more with access to affordable health insurance and re-enroll the millions who enrolled during the first open enrollment period. That's going to take every effort from the beginning back in November up until we reach the end deadline. And it'll take countless individuals and organizations dedicated to every American having access to quality and affordable care. Our hope is that through your work that you can continue to take the lead in your communities to educate and mobilize local leaders, grassroots networks, and everyone who looks to you for leadership and information. We hope you and everyone in your network will actively and continuously urge the uninsured to enroll, leading up to throughout the enrollment period between now and February 15th, again in these next 30 days. I just want to mention that in our history as a community of individuals with disabilities, we have often been overlooked or left out, but not with this. We were first in line in advocating for the ACA, and in many cases first in line for enrolling once it became law. This work that we're doing is to ensure that we get what we need, again, not just for health care, but to put us on the pathway to middle class and to ensure that we have full inclusion in our society. Now, I have quite a few numbers that they've provided me with. I'm a little bit of a numbers nerd, so I'm not going to share all of them with you, but I do want to share just a few statistics because I think it speaks to the impact that you all are having in the communities that you serve. Just in the last through, I'd say, 2 months, through January 9th, as I mentioned, we've had 6.8 million people select plans. We've had 8.8 million individuals submit applications, and we've received 8 million calls to the call center with volume just last week between January 3rd and January 9th of 750,000 people calling. We've got an average call center wait time in the past week of just 6 seconds, and we are able to connect individuals with resources, particularly Spanish speakers, in just about 3 seconds. So we've got the resources available to you. I know you know www.healthcare.gov. I can't say that enough. I know you know the call centers, and certainly, as we'll hear from Carl later, you have access to resources that you need to ensure that people with disabilities have the information that they need as they're seeking enrollment into the plan that is right for them. One additional resource that I want to give you, particularly as we go into these last 30 days of enrollment, is my contact information. Quite frankly, as individuals with disabilities, as they're signing up for the marketplace or signing up for plans, if they're encountering issues or if you have questions, I may not be able to answer the questions directly, but I will certainly do my best to put you in contact with individuals, particularly at HHS, who can. So my email information is, you can email me at disability@who.eop.gov. Again, it's disability@who.eop.gov. By using that email address, if you have a health care issue, certainly I will do my best to put you in contact or with the folks over at HHS or to find an answer, because truly no question is too small or too large when it comes to getting individuals, Americans with disabilities, connection to health care. I'm going to stop now and turn it over to Roberta, but certainly I am going to be available throughout the webinar to answer questions and to take your questions. And if I don't have an answer now, I will certainly follow up and make sure I get the answer to all of you. Thank you.
Thank you, Taryn. Thank you so much, and thank you for sharing your personal story, the latest data about enrollment and call center waiting time, excellent information, and just general information about the Affordable Care Act and in general. I would now like to turn it over to Carl Cooper, who will kind of walk us through his slides and tell us about the National Disability Navigator Resource Collaborative and what AHD is doing with our partners to ensure enrollment specialists have the absolute quality information to serve people with disabilities as they enroll in the ACA. Carl?
Thanks, Roberta. First of all, the National Disability Navigator Resource Collaborative, or as we know it, the NDNRC, came out of a concern of disability organizations that navigators and other assisters would not have a sufficient knowledge base to assist individuals with disabilities as they made healthcare enrollment decisions. Several of these organizations began discussing ways to reach out to the navigators to provide technical assistance and better prepare them for assisting this population of consumers. So what is the NDNRC? It is an initiative of those national cross-disability organizations in order to provide disability information and support to navigators and other enrollment specialists as they assist consumers with enrollment through the ACA marketplace. Who makes up the NDNRC? There are 10 partner organizations, including our own organization, the American Association on Health and Disability, along with the Association of University Centers on Disabilities, Autism Speaks, Christopher and Dana Reeve Foundation, Disability Rights Education Defense Fund, Family Voices, the National Alliance on Mental Illness, the National Multiple Sclerosis Society, the YARC, and United Spinal Association. As you can see, one of the main strengths of our collaborative is in the cross-disability makeup of our partners. It's estimated when the Affordable Care Act was passed in 2010 that 3.5 million people between the ages of 16 and 65 were uninsured and also had pre-existing medical conditions and or disabilities. These individuals face multiple options when enrolling for health care coverage under the Affordable Care Act, including Medicaid in their state, possible Medicaid buy-in in their state, possible Medicaid expansion, and the exchange marketplace insurance coverage. So as you can see on the slide, it's the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. One of the main ways we do that is through our website, which you can find at www.nationaldisabilitynavigator.org. There you'll find all our resources, both our own and resources from other organizations that are helpful to those that are trying to enroll people with disabilities in health coverage. You can see there some drop-down menus on the screenshot of our homepage, which includes the About Us, where you can find out information about the partner organizations I mentioned earlier, as well as other friend organizations that are helping us get out the word about the NDNRC. Under Conversations, you can submit a question or view frequently asked questions. Under our Materials section, you can find the guide that I'll be talking about in a moment, as well as our fact sheets that I'll be speaking about. Further down the homepage, you can see our state resource map, and our state resource map is something that we're very excited about, as it allows you to get information that is specific to your state. I'd also be remiss if I did not mention to the left there, our Twitter feed. For those of you on Twitter that are interested in following us, you can follow us on our Twitter handle, which is @NDNRC. But if you go to the state resource guide and click on one of the states, you can find information that is specific to that state. So, for instance, here you can see a shot of the Colorado state page. There you can find information about what kind of marketplace type each state has, whether that state has expanded Medicaid or not. If there is a state-based marketplace, as there is here in Colorado, you can see we have the contact information for that state-based marketplace. I'll be talking about our community outreach collaboratives later on. For those states with a COC, you can find that contact information. We also have the assistive technology program information for every state on the homepage, as well as links to state and local chapters and affiliates for some of our partner organizations that have them. We also have state-specific resources for all 50 states plus the District of Columbia, and we also link to state-specific news or blog posts that address those states show up on those individual state pages. I mentioned earlier a resources page that you can get to from our homepage. These are the various categories of resources that we have, including disability-specific ones where you can get information from our partners and friends. Under the mental and behavioral health includes information from SAMHSA and some other mental health organizations. Populations with special health care needs deals with things that are beyond just disability, such as the American Heart Association. Under the ACA Marketplace and Medicare and the ACA Marketplace and Medicaid, this has resources from CMS as well as other organizations that are specific to those two different programs. Under our overview is our largest category, and for those of you who are doing enrollment, I would encourage you to check that out, and the first resource listed under that is the Navigator guide that was put out by the Georgetown University Center on Health Insurance Reforms, which is a very helpful toolkit for anyone who is doing enrollment work for the broader population, not just those with disabilities. Our enrollment statistics, we have up-to-date information about as it comes out, including Medicaid enrollment figures as they are released as well. And then finally, the last two ACA resources, both governmental ones and also enrollment resources, are from other organizations. So mentioned, one of the resources we're most excited about is our disability guide. It was released a year ago and was recently revised. It provides information to navigators and other enrollment specialists about special considerations people with disabilities face as they shop for health coverage. I want to especially thank the Disability Rights Education Defense Fund, who wrote the guide for us. And also, I would like to take at this time the opportunity to thank the Robert Wood Johnson Foundation, who were the funders of our project. If you go to the disability guide, you can find the table of contents and all the different things that are listed here in terms of what various things you can find. Basically, the disability guide is meant to serve as a disability 101 and to expand on the training that was provided from CMS to the individuals that are doing enrollment. And it's meant to basically take it to the next step in terms of really trying to help those navigators understand the special needs that people with disabilities have as they're considering health insurance plans. In terms of the specific category of what navigators need to know about disability, in this area we deal with all sorts of issues that really get down to the nitty-gritty of what the navigators really need to be thinking about when they're looking at or helping an individual with a disability look at a health plan. And we'll be talking about some of the scenarios that come up for these individuals in just a moment. In year one, we also released 16 fact sheets. You can see the first 9 here listed on the screen now. And these were all topical fact sheets that dealt with a bunch of different areas. The first 3 that we put out were geared more towards getting the answers to the questions that you need. And then we got into some more specific information, specific issues, I should say, such as rehab, rehabilitation services, prescription meds, some mental health issues. And we also got into some of the Medicaid issues, such as the medically frail status, and also the process for Medicaid eligibility, as you can see on this list as well. We also had a fact sheet that came out in year one that was specific to veterans. I'll be talking about population-specific fact sheets a little bit later in the presentation, as far as the veterans fact sheet as well. When I talk about health insurance and people with disabilities, I like to refer to it as health insurance Jeopardy. For those of you who are familiar with the game show, you know that in Jeopardy, it's not about the answer, it's about making sure you ask the right question. And that's really what we view the issue being with people with disabilities as they are considering their possible plans that they could enroll in under the Affordable Care Act marketplaces. So let's go ahead and play our game and start with prescription drugs for $200. And these are all different scenarios of people that a navigator might encounter, or even for those of you who are consumers might find might relate to some of these things and things you need to be thinking about when you're considering a plan. The individual has a disability that causes spasms. In this instance, you need to ask the question of whether or not the person takes medication to treat that. Assuming the individual does take a prescription muscle relaxant, then you also need to ask questions such as, how do you find out what medications are covered by the qualified health plan? Also, you need to ask the question of whether or not the qualified health plan has a tiered prescription medication benefit, which basically is where medications are put on different tiers by the insurance companies, and the higher tiers require higher copays and therefore are more costly to the consumer, and you need to consider that when really evaluating what the overall cost of a plan is going to be. If the individual takes the prescription, you also need to ask whether the qualified health plan requires pre-authorization for medications, because if the person is taking it and there is going to be a pre-authorization required, there could be a delay in the person continuing to stay on that, and that could be a problem for the individual. So they might want to make sure that they've got enough medication to get through any possible pre-authorization that's required. If the individual tells you that he has tried generic drugs before and they were ineffective, then you really need to ask the question of whether the qualified health plan requires a patient to try a generic drug first, commonly known as step therapy. Because if that's the case, it might be a problem for the individual because they will be required to try the generic drug when they know that the brand name one is the only one that works for them. Moving on to medical devices, if the individual is a wheelchair user, you need to ask the question of whether the qualified health plan covers durable medical equipment, or DME. If the individual uses a motorized wheelchair, but she complains that her current chair isn't keeping a charge, you need to ask whether the qualified health plan covers the repair of the DME. Under the Affordable Care Act, one of the essential health benefits is medical devices, but medical devices is not a defined term under the Affordable Care Act, and HHS has not defined it yet. Therefore, it's being defined by the states and the individual insurance plans. So it varies greatly from plan to plan, from state to state, what is covered. And sometimes equipment is covered, but repair is not. And you need to make sure that everything the person is going to need is going to be covered by that plan. If the individual indicates that his condition requires he use a catheter, then you need to ask the question of whether the qualified health plan covers disposable medical supplies. And supplies and equipment are many times treated differently under plans, and sometimes one is covered and the other is not. So you can't assume just because one is covered that the other is going to be. So you need to make sure that you are really looking at the plan and figuring out whether or not it's going to meet the needs as you have them. If the individual is an amputee, the question obviously is whether the qualified health plan covers prosthetics, but it goes beyond that. And you also need to ask whether the qualified health plan puts limitations on the number of prosthetics. We've heard of plans that have put on a limit on the number of prosthetics an individual can get to 1, and that's obviously a problem if someone has lost both their limbs. So that is something you want to make sure that it's not going to be a problem for that individual. If it does cover it, you need to make sure that the limitations are appropriate for that individual. If the individual has limited mobility but indicates that certain therapies have helped her maintain the mobility she does have, you need to ask whether the qualified health plan covers rehabilitation therapy, which is a very common thing. But for people with disabilities, rehabilitation therapy becomes a little more complicated because this individual might tell you that she hasn't seen a physician for the condition in some time. And in this instance, you need to ask the question of whether the qualified health plan requires pre-authorization for rehab therapies, which many times is required. And if the person has been on this rehab for a while, it might be a problem that the person's going to have to go back to the doctor to get that pre-authorization again. You also have the problem with rehabilitation therapy for people with disabilities in this instance, where this person says that she has to go repeatedly for it to have any lasting effect, commonly known as maintenance therapy. And in this instance, you need to ask the question whether the qualified health plan puts limitations on the number of rehab visits that the individual takes. If you have an individual with a family that has a child with a developmental disability that affects their activities of daily living, then the question you need to ask is whether the qualified health plan covers habilitation therapies. And in this instance, the habilitation therapies are basically what, if you think of rehabilitation, it's taking the RE off that, so you're not getting something back that you've lost. Instead, it's trying to acquire a life skill that you never had. And it's very useful for children with developmental disabilities as it helps prepare them as they age into adulthood to live more independent lives. So for those individuals, habilitation therapies are very important, and you want to make sure that the individual is going to have what they need in order to be able to take advantage of those therapies. More specifically along these lines, if you have a family that has a child with autism, you need to ask the question of whether the qualified health plan covers ABA therapies. ABA therapies, or applied benefits analysis therapies, are therapies that are sometimes used for families who have children with autism, similar to developmental disabilities, where they are helping the child be able to develop life skills that will allow them to function more independently as they age. As we get into Medicaid eligibility, I do want to say one caveat about this area. We are a national organization, and Medicaid policy is very different in every state. As a result, we do not claim to be Medicaid experts in terms of what is needed for Medicaid eligibility, as that will vary greatly from state to state. But we do want to go over some of the basic issues of what happens when someone's applying for coverage through healthcare.gov and how that gets treated in terms of the Medicaid eligibility determination. So when you're completing the enrollment on healthcare.gov, you're going to arrive at the question that asks about a condition which causes a limitation. In this instance, you want to ask whether the individual wants to apply for Medicaid. And why is that? The individual answers that she does have a condition which limits her activities. Then the question is, what happens to their healthcare.gov application, and how are they determined whether they are Medicaid eligible? And the answer on this is, if you answer in the affirmative on that, you're going to be sent to the state to get a Medicaid determination. And the state Medicaid office will ultimately make the determination of whether or not the individual is qualified to receive Medicaid. That does mean that there will be a delay with that person's application if it's ultimately found out that they are not eligible for Medicaid. Now, they will have the opportunity to still enroll in health insurance, but they will have to wait for that Medicaid eligibility to be determined. And that's one of the reasons why, for those individuals that know they're not going to qualify for Medicaid because they know their income is going to be too high or such, then many times those individuals will actually end up answering no to that question when, in fact, there is the issue of they technically would qualify as answering yes the way the question is worded. So it's one of those things you're really going to have to think about whether or not a Medicaid application is appropriate for that individual. If the individual has cerebral palsy and it affects her ability to walk, talk, and breathe, then you also need to ask the question whether or not the individual is what's referred to as medically frail. Medically frail is a specific designation under the Affordable Care Act that allows states to define a specific category of individuals that are available, that can receive a special designation under under Medicaid in that state. And if the individual does qualify as medically frail, then the question becomes whether the state offers an alternative benefit plan for the medically frail. That's what I was talking about. States that have a medically frail designation can then create a separate set of benefits for those individuals that's referred to as the alternative benefit plan, and the individual then can apply and seek coverage under the alternative benefit plan rather than traditional Medicaid. So let's assume the individual does qualify as medically frail. and the state does have the alternative benefit plan for that category. Then the question you need to ask is whether the individual should enroll in the ABP or traditional Medicaid. And for that question, it's not necessarily a simple thing. Just because the person does qualify doesn't mean they have to go into that. They could still go into traditional Medicaid. And just like comparing health insurance plans, you're going to want to compare the alternative benefit plan with the traditional Medicaid to really determine which is going to be a better fit for that person's medical needs. Talking about the summary of benefits and coverage, which is where we get our answers to the questions that we have, the individual wants to know if the plan will cover a specialist that he sees. You need to ask the question whether the summary of benefits and coverage says whether or not the plan uses a network of providers. If the individual has a condition that requires that she take a specific drug, then you need to ask whether the summary of benefits and coverage says what drugs are covered and what the drug copays are. And as I talked about earlier when I was speaking about prescription meds, ultimately what's going to end up being the issue with respect to the cost of that and what's ultimately going to really determine what ends up happening with that. If the individual uses rehabilitation therapy, you need to ask the question of whether the summary of benefits and coverage says what the cost will be for rehabilitation therapies and if there are limitations on that. One of the things that's great about the Affordable Care Act is it got rid of the dollar limitations that existed before that insurance plans had in place. So for instance, if someone used up the amount of dollar figures that was put on a lifetime cap, then they were no longer entitled to receive any additional benefits. The Affordable Care Act did away with that, so insurance companies can no longer limit the number of dollars someone uses under their health plan. But what it did not do was eliminate the number of services that the insurance company could limit. So they are allowed to put limitations on rehabilitation therapies and other therapies and visits and drugs and those types of things. So specific services are allowed to be limited. So that is something you're going to want to make sure that you're looking at when you're looking at those types of things, is whether or not those limitations are going to cause a problem for the individual. If the individual is a wheelchair user, you need to ask the question of whether the summary of benefits says what the cost will be for services such as DME. And also, if it's unclear about the coverage of or limitations on the durable medical equipment, then you need to ask the question of where you can get the answers on coverage when they're not covered in the summary of benefits and coverage. Now, one of the things I do like to point out when I talk about this area, I myself use a wheelchair, and I was looking at plans under the Maryland Exchange where I live, and it was difficult for me to get the answers to those questions in terms of whether or not my wheelchair was covered. I will say this, if it was difficult for me, someone who knew to ask the questions, and I knew to ask and I knew where to look to get the answers, and if I still had a difficult time asking and getting an answer to that question, then imagine how much more difficult it's going to be for someone that's never had health insurance before and they don't even know what questions they should be asking. That's why I say it's so critical to be asking the right questions in the first place, because if you're not asking the right questions, it's very possible that you're not going to get the answers you need to be able to get the coverage that ultimately you need. Moving on to mental health, if the individual reports that he has treated for a mental health diagnosis, the question you need to ask is whether the qualified health plan covers mental health treatment. If the individual reports that his prior mental health treatment required several therapy sessions a month, the question you need to ask then is whether the qualified health plan limits the number of visits for mental health therapy and whether that's permissible under an act known as the Mental Health Parity and Addiction Equity Act, which is an act that basically said insurance companies had to treat mental health the same way that they treat other types of health. So if they put limitations on rehab therapy, for instance, they can also put limitations on mental health therapy in a comparable way. So those limitations are allowed, but they have to be comparable to what is in other areas of the plan. If the individual reports that she has struggled with a drug addiction in the past, the question you need to ask is whether the qualified health plan covers substance use disorder treatment. And the reason that is if the individual also reports that this struggle has been ongoing for some time and has affected her ability to perform normal daily functions, you also need to ask the question of whether the chronic substance use disorder qualifies the individual as medically frail, because the Affordable Care Act does allow states to define the medically frail status as including chronic substance use disorder that affects someone's abilities to perform daily functions, which then allows the state to develop an alternative benefit plan that would be geared towards those individuals to receive the substance abuse treatment that they would need. And then moving on to mental health, for those people that are doing enrollment work, I always like to talk about mental health, and other hidden disabilities as the great unknown. And many times you need to ask the question of whether the individual needs coverage for mental health, as they may not self-report to you. And that's really an issue that it comes up with some individuals that have mental health or other disabilities that are more hidden. For those people doing enrollment work, they need to make sure that they're getting the answers to the questions that they need in terms of what coverage that person needs, and make sure that they know the conditions that the individual has. For those people doing enrollment work, if you'd like, you can contact me afterwards, and I'm happy to give you some tips on some ways that you can get the answers to those questions without being completely upfront and possibly insult the individual. We can give you some tips on how you can address those questions with those individuals. In terms of our year one observations, in year one we observed some needs affecting people with disabilities in the ACA marketplace. They represent trends that we have seen both with navigators and consumers, and are in addition to the ongoing complication of the interrelation of Medicaid with the enrollment process. And here is the list of areas that we came up with. The deaf and hard of hearing basically was an issue of navigators needing sign language interpreters and figuring out how to pay for that when they're trying to meet with a consumer who is deaf or hard of hearing. Children with special health care needs is an area that we got requests for additional information on. Behavioral health, mental health, and substance use disorder is an area where there's a lack of providers and network adequacy and marketplace plans. In terms of prescription drug formularies and rehab and rehabilitation therapies, one of the main issues we have in those areas is finding out that there is an issue of getting the information that individuals need to really evaluate their plans. And I always tell individuals that they really want to do some advocacy on the local level. One of the things they can really do is push their state insurance regulators towards plan transparency, so the plans that are offered in the marketplace are plans that show exactly what is offered in those plans, so that individuals can make an informed decision when they're deciding which plan they should enroll in. And that also goes with the durable medical equipment and assistive technology. Coverage for individuals needing newly receiving SSDI is more of a generic issue, but it does. We receive concerns about individuals who have been approved for SSDI, but they're in that waiting period until Medicare kicks in. And generally the question's been whether that person can get a premium tax credit, or if there's some other form of financial assistance available, or if the person would even qualify for Medicaid in that instance. And then enrollment accessibility is a thing that we're constantly monitoring, dealing both with navigators as their offices, whether they are accessible, as well as when they go out on remote locations and are part of larger community events, making sure that the navigators are doing so in a way that will allow for everyone to be able to use their resources. But it also goes beyond physical accessibility, and it deals with the accessibility of materials so that they're available in alternative formats such as Braille, large print, and modified versions for low literacy and cognitive disabilities. One of the things we found in year two was the different areas that people wanted more information in. So you'll see here a list of 4 new fact sheets we're going to be releasing this year, and they are going to be out in the near future, so that you should be on the lookout for them in terms of new fact sheets that we'll be releasing in addition to the ones I referenced earlier. But we also got a request for more information that was more specific, and we found that any of the fact sheets that were on a more specific topic seemed to get more attention. So we came up with the idea of having population-specific fact sheets, which deal with issues when dealing with a consumer in a specific population group, such as autism spectrum disorder, a child with special health care needs, intellectual disability, mental illness, multiple sclerosis, paralysis. And then I referenced the veterans fact sheet earlier. We've reclassified that fact sheet out of the topical fact sheets and into this population-specific fact sheet category. In terms of which of these has been released, autism spectrum disorder, intellectual disability, mental illness, multiple sclerosis, and the veterans fact sheet have all been released already. The children with special health care needs is being released today, and our announcement will go out on that tomorrow. So be on the lookout for that. And the paralysis fact sheet should be out in the near future. We also realized in year one that there was a general shift in year one towards outreach and not as much focus on the technical enrollment piece. And we recognize that people with disabilities many times have a distrust of experts that they don't perceive as having expertise with their disability. So in year 2, we are funding 11 community outreach collaboratives, or COCs as I mentioned, or as I call them. The COCs will increase collaborations in the community, dissemination and outreach efforts, and enrollment of people with disabilities in the ACA. The COCs will have 2 primary tasks. The first is to build cross-disability collaborations with other disability organizations at the local level. And 2, they'll have cross-disability collaboration work as a dissemination and outreach resource with their local and or state navigators and assisters. So in other words, they're going to be forming a bridge between local disability organizations and consumers and the navigators so that they can make sure that those individuals who are needing consumer assistance can reach the navigators and know that they'll have a comfort level with those navigators, that they're going to have the resources they need to be able to assist them, and also allows the navigators to have a place to go if they have specific questions that they want to have answered. It allows the communication to go that way as well so they can reach out to the local disability organizations to be able to ask questions too. We're very proud that the COCs represent organizations with geographic diversity, as you can see here on this map, as well as varying constituency within the disability community. AHD is proud to say that the 11 COCs represent 11 different states and are located in 9 of the 10 HHS regions. For the list of actual locations, this is a list of those 11 locations. For those of you who live in one of these 11 states, we would encourage you to reach out to these organizations should you need assistance. As I mentioned earlier, their contact information is on the state page where the COC is located, so you can go to our homepage. At the bottom of the homepage, go to that state resource map, click on the state that you're looking for information on, and you can find the contact information for the COC there. In terms of, for those of you who are looking to stay involved with our project, you can sign up to receive weekly updates for the NDNRC at our website, which once again is www.nationaldisabilitynavigator.org. You can also sign up for our AHD newsletter at the website listed there. And we also have a resource center that you might want to check out at the link that's located there as well. And all of these slides, just so you know, will be put up on the National Disability Navigator website. They will be put up by the end of the week. And finally, that's our contact information. You can feel free, if you have questions, to reach out to me if we don't get to your question today. Email is usually the best way to get me, so you can feel free to go ahead and email me there. And we'll be happy. If we don't know the answer to the question, we'll try and put you in touch with someone who does. But at this point, we will open it up to questions. And Roberta, do we have any questions, either for me or for Taryn?
Yes, we do. And thank you, Carl, for that excellent and very informative presentation. A few quick questions first before we move into the more substantive questions that we received. A number of people wanted Taryn's email address again, and I am going to repeat that. That's disability@who.eop.gov. And another question was, this would be for Carl, where can I find the contact information for the COCs? Is that on your website?
And yes, the COC information is on the website. As I said, you can go to the state page for that specific COC for those 11 states that were on that slide. You can go to that state page and get the contact information. If you're still having difficulty, you can always email me, and I'm happy to provide it as well.
Okay, thank you. Question, is it my responsibility to bring an interpreter when I am meeting with a navigator? And I know this has been an area that's raised a lot of concern.
I'll put my lawyer hat on for this, this question. Under the Americans with Disabilities Act, the consumer is not obligated to provide that service. So they should contact that navigator and let them know that they require that, and the navigator office should provide that service for them. The question that we've gotten from the navigators is who pays for that, and that's really an issue between the navigators, the insurance companies, and CMS in terms of who should bear the burden of that cost. But one thing is clear is the consumer is not the one responsible. Under the ADA, they are not responsible to provide the cost for that.
All righty, thank you. Okay, this one's a bit long, and this one is for you, Carl. Based upon Carl's comments, has there been progress in having CMS require QHPs to direct clients with disabilities or special needs to a list of plans in their state that cover their particular needs without having to review all the plans offered in the resident state?
I am not aware of anything like that. I know that it can be very daunting to look at all the various plans that are offered in every state on the marketplace, and there's really no easy way to get the answers to those questions. The best thing I can tell a consumer that's in that situation, if they're having difficulty going through all that, is that's really where the consumer assistance from a Navigator or someone like that is critical, and they can find help for that. For those of you looking for assistance at the local level, the thing that I would suggest you do, for those of you who live in one of the federally facilitated marketplaces, the easiest way to do it is go to healthcare.gov, and there's an option there, Find Local Help. You can click on that, enter your zip code, and you can find a Navigator or other enrollment specialist near you. If they're having difficulty with your disability issues and trying to understand exactly what's required, by all means put them in touch with us, and we can provide the technical assistance that that individual needs that will allow them to go ahead and get that information so that they can help you. For those of you who are in state-based marketplaces, there is a similar feature on those state websites as well to find local help, but all marketplaces, whether they're federally facilitated or state-based, are required to have consumer assistance programs in place, such as the Navigators. And I would take advantage of that if you're having a difficult time looking through all those plans.
Okay, thank you. Okay, I kind of lumped these questions together. They all have to do with the enrollment deadline, and I know Taryn mentioned that the enrollment deadline is February 15th, and we had a couple questions coming in from people that want to know what happens if they miss the February 15th deadline, and who enrolls in the summer and between the February 15th deadline and the beginning enrollment at the end of, I guess that would be October in 2015. So those were two or three enrollment questions. So I don't know, Taryn or Carl.
I mean, in terms of,
go ahead, Carl.
I was just going to say, the February 15th deadline is a hard deadline. So, I mean, last year they did extend and allowed for, those people that were what's referred to as waiting in line. So if you started your application by then, you could still finish it. But there's no guarantee that will happen this year. So you really need to make sure that you do it by February 15th. There are special enrollment periods. If you have coverage and you lose it, after February 15th, then you can go and enroll in coverage to the marketplace if you qualify for one of those special enrollment periods. And the other thing that I would point out that sometimes does affect people with disabilities, if you are eligible for Medicaid, Medicaid has year-round eligibility and determinations. So it does not matter what time of year it is. You can always apply for Medicaid to see if you can get coverage that way.
This is Taryn. I was going to echo that exact point, that latter point, Carl, that Medicaid is 365. So if you have eligibility, then you can absolutely continue to seek out Medicaid in your state. And as it relates to that February 15th deadline, indeed, it is a hard deadline. And so that's why we're pushing so much to get folks enrolled by February 15th, because we certainly can't say that it'll be extended as it was in 2014.
Okay, great. We just got a comment from a person who actually is responding to the caller about the interpreter. And this individual said, as a Navigator organization, we are required by CMS to provide interpreters as well as other accessibility options. They budgeted for it and they were approved. So just kind of throwing that out there, circling back to the interpreter question. Okay, here's a question about Medicaid. And again, some of these may be above what we're able to answer, but we'll throw it out there just for discussion. If I only have a minimum Medicaid, can I still qualify under the Affordable Care Act?
I'm assuming they're asking the question about whether they can still get tax credits through the marketplace. Because here's when it comes to the plans under the healthcare.gov, they are required to provide minimum essential coverage, and Medicare and Medicaid are considered minimal essential coverage. If someone does have minimal essential coverage, they can still enroll in the Affordable Care Act marketplaces, but they cannot receive the premium tax credits that make it more affordable. So that's the one thing that you really need to think about when you're really considering that. Is many times if you can't get the subsidies, it becomes where it's not cost effective to be able to afford to pay for that insurance. So the answer is, can you still receive, can you still enroll? Yes, but you won't be able to receive the premium tax credits.
Okay. Well, we're just about out of time, but we have just one or two questions left here at this point. I hope I'm interpreting this one correctly. How can one get help when you have an insurance but the deductible is too high?
That is actually something that really is something that came to our attention as well as people were looking at in year one. When they got into it, they started using it, they realized how high their deductible was. The only thing I can say about that is that's something you really need to be looking at when you're considering the plan in the first place. The place to really take care of that issue is when you're picking a plan. And many times people will pick the cheapest premium, and that is not always the best value for that individual, because if you look at what it's going to cost you over the long term, it might actually end up costing you considerably more than if you pay a little more for a premium every month, but then ultimately the deductibles and copays and all that kind of stuff are much lower, thereby making that plan actually much more affordable in the long run. So it's something you really need to look at and evaluate how much you're going to utilize your health care and weigh that against the copays and deductibles and then the premiums, and look at what a total cost for the plan is going to be over the course of the year.
Okay. Last question here is specific to the call center. Taryn, do you have a phone number for that call center?
Yes. So a number I have here is 1-800-318-2596. And that's a number that consumers across the country can continue to reach out for in-person assisters. In addition, you can go to healthcare.gov, of course, or cuidadodesalud.gov. I think I might have just said that with a bit of a French accent. My apologies. But that is the Spanish site for healthcare.gov. But again, that number is 1-800-318-2596, or you can visit healthcare.gov.
Okay. Well, we just got a few more questions coming in at the end, but our time is up. So for those of you that we were not able to get to your questions, if you can email them to Carl, again, that's kcooper@aahd.us, and he will do his best to answer the question, and if the question is more appropriate for Taryn, we will send it on to her. So again, I would like to thank Taryn and Carl for presenting a very interesting webinar today, and I would like to thank all of you for participating in the webinar. And again, the NDNRC is a resource for you, whether you are an individual involved in enrollment or a person with a disability that has additional questions. So please use us as a resource. And thank you to Taryn for everything that the Office of Public Engagement is doing to help promote enrollment and outreach this year. Thank you.
Thank you for having me.
Thank you.
Thank you.